Welcome to the Natural Health Revolution, a weekly podcast that focuses on bringing science and nature together by bringing you the top experts from the fields of science, health, nutrition, and well-being.
We are Circle of Light, bringing you wholesome, all-natural ingredients to help you on your journey to long-term well-being. Take care of your gut health with our delicious Fibre 89 soluble drinks. Reap the nutritious natural benefits of the unroasted green coffee bean with our unique green coffee range. And restore your body with our all-natural herbal night drink, Triple Z. Choose health the natural way.
I'm Dr. Sarah Kelly, CEO of Circle of Light. Join us as we dig into all things health and find some inspiration along the way. On today's episode, we are going to deep dive into women's health, particularly the sensitive issues of fertility, hormonal health, and the many complications that arise when women are not supported or don't have access to the information that could make this journey easier. Joining me is Dr. Michelle Hone, founder of the Fit Clinic, where she specialises in fertility, working one-to-one with women who she says can feel lost as they try to understand the difficulties of hormonal issues. Michelle is a beacon of hope to those who follow her on social media, regularly posting facts and practical advice that demystifies subjects like polycystic ovary syndrome, a condition that the HSE estimates affects 1 in 5 women of childbearing age. With a PhD in nutrition from DCU, Michelle has been published in several peer-reviewed journals. Michelle has had her own difficult experiences and understands the grief and heartache that can come with this subject. Listeners are advised that the topics of pregnancy, infertility and miscarriage will be spoken about in depth. Hello, Michelle. How are you? Great to have you here today.
Thanks for having me.
So I'm going to start with the Fit Clinic because I want you to tell me about it. So I remember you as a PhD student. So I was a lecturer in DCU and you were a student with a spring in your step. And that's when I first became aware that you had a page on Instagram. Is that fair to say that that's what it started out as?
Yeah, so I suppose I started in sports science and I went on after that to do a PhD in protein and amino acids and its effect on recovery from exercise and also in older adults in preventing, I suppose, age-related muscle loss. That's the kind of short version of it. And I think I was a year into it and I decided to just set up this page. And the idea behind it was an Instagram page and a Facebook page. The idea behind it was just to, I suppose, take research papers and I suppose just kind of explain them in easy to understand terms. You know yourself with a PhD, you become very pigeonholed into one specific area. And I was conscious that yes, I'd become very, very knowledgeable in the specific area to do a protein, but I wanted to learn more about things outside of protein. So it was kind of just a prompt for me, a push for me to really learn outside of that area. And yeah, very quickly people just started to contact me and ask me to kind of be there, just for nutrition advice essentially. And I think maybe 2 years into my PhD, it just blew up. Yeah, it was just a snowball effect. And it just reached a point where with a PhD, there was no way I'd be able to maintain both on my own. So I started to take on other nutritionists and nutritional therapists. And now we have a team of 12 nutritionists and nutritional therapists, which is great. Yeah.
So impressive.
They're amazing. Yeah.
And knowing what goes into a PhD, it's phenomenal that you were able to even have the headspace to manage both.
Yeah. I think part of it was that I'm quite creative. So it was almost like an outlet almost. So I used to design, I used to love designing the graphics of posts. So it was almost like a hobby in a way. And it just so happened that it was related to nutrition. So I was really fortunate in that way.
And the name, the Fit Clinic, so it's very much would suggest fitness, performance. Is that where it started out as something to help people?
Yeah, definitely. Yeah. So I suppose it was probably in around the same time that I started doing CrossFit as well. So I took a really big interest in performance nutrition and how our body responds to exercise and how nutrition can help that. And yeah, it just, I suppose at the beginning, it was very much female CrossFit athletes that I would have attracted. And now it's kind of just, I suppose, evolved from that and branched into different areas.
And that's from chatting to you. I don't think I've ever heard you talk about weight loss per se, or that doesn't seem to be the big goal. That's not why people are drawn to you.
Sometimes it is. Yeah, you'll find that a lot of people, it's sometimes maybe a secondary goal. They're I'm coming to you for fertility or I'm coming for you for PCOS, but I'd also like to lose a little bit of weight. But yeah, I'm also just kind of mindful to not really market ourselves or kind of push weight loss because there's just so much more to nutrition than just weight loss. Definitely. There's so much that you can do to help someone's health when it comes to nutrition and supplementation lifestyle.
Even a quick look at your Instagram page and you would see health is definitely the focus.
Yeah.
Across the board. So do you find with even your coaches, because there's so many different areas of nutrition, do you find that you have to have different coaches that specialise in different areas?
Yeah, so this is the kind of thing that I love about our team. So everybody in their own right has their own area of expertise. So we would have 5 of our nutritionists, say for example, that would really specialise in female hormones, and it's all about periods and menstrual cycle and PCOS and hypothalamic amenorrhea and fertility. And then we have 3 of our nutritionists who would really specialise in relationship with food. So anyone coming to us who we feel like could really improve their relationship with food or kind of has disordered eating patterns, they would really specialise in that area. And then we would have like nutritionists who would kind of specialise in digestive health. But at the same time, it's very much a collaborative team. So we all kind of learn from each other, which is great, because you're never going to have a client who's like, I'm just fertility, or I'm just relationship with food, or I'm just digestion. Like very often people are coming to us and they have like kind of several issues. So it's great to kind of have that, collaborative team effort, which is great.
And you personally, so you said you started out was working with say females who were trying to become better athletes or better CrossFit athletes, but now you've really sort of moved away from performance altogether. So with the majority of the clients that you work with, is it always females, or have you gone away from males completely?
We definitely do still have some male clients, but I think do you know what it is? There's just so much misinformation when it comes to female health, and we've chatted about this before, and I feel like we're at this point where we're, I don't know, like breaking down taboos really, and just empowering ourselves with the knowledge that things that we should have been taught in school really. Like I put up like a 1 minute, like a 60-second video on the menstrual cycle, and someone messaged me and they were like, I'm a teacher, and like, if you can do this in 60 seconds, like why isn't this on the curriculum? It's 60 seconds long and nobody knows, like not that nobody knows about it, but we're not being taught it. Like we don't know it when we're 18, we don't know it when we're 21, unless we go out and like seek out that information, which I just don't think is right.
And I suppose you've said the word taboo, and I think every podcast I've recorded to date about female health, I have used that word.
Yeah.
And again, you're saying people don't understand their menstrual cycle because we don't talk about it.
I know, like there's still people that like won't call it a period. I'm like, it's like, oh, my time of the month, or I'm like, it's your period, it's fine.
Yeah, 100%.
Even like, it's funny, I put up like a video a few weeks ago and it was basically explaining like these are the different signs of ovulation, and one of your signs of ovulation is like your cervical fluid, and it like changes to this like in a raw egg white consistency. Yeah. So I put up a video and I was like, because so many people are like, oh, I don't really know, like is this what it looks like? So I was like, I'll just get an egg and I'll put it in a cup and I'll just show what it is. And my friends were like, Michelle, I can't believe you put that up on Instagram. And I'm like, what? How is that a taboo issue? It's so normal. It's like constipation, it's like diarrhea. It's such a normal thing. So
the shame associated with the conversation, or an embarrassment or something behind closed doors. Whereas you said, and I remember that post, that is such an important post for anyone who is trying to get pregnant.
100%. And it's like, these are the things that people don't know. And like, these are the people that are so in the dark about their fertility, and they've been trying for several months and nothing's happening, and they've gone to their GP and their GP hasn't told them like what are the signs of ovulation. So I just think it's so important to get that kind of information out there. So I suppose I think that's a big part of why we've really specialised in female health, because there's just so many misconceptions and misinformation.
And how do people know if they're having struggles with fertility? Would people realise that the issue might be nutrition? So is that what you're trying to do, I suppose, with your Instagram page, get that message out there?
I think so, yeah. Yeah, so with, like, I always say that when, and this is no disrespect whatsoever to GPs, like GPs are very much general practitioners, so they don't specialise, and like no one expects them to be an expert in every single area. But if you're under the age of 35 and you go to your GP and you've been trying for, say, like 6 or 7 months, they will say to you, oh, well, the definition of infertility at this age is if you've been trying for 12 months without any success. So they'll just tell you to continue to take your folic acid and keep trying. Like, not saying this is obviously a gross generalisation, but
of course,
this is what the kind of dictionary definition of infertility is. And then if you're over the age of 35, it will be like, okay, 6 months in, that will be classed as infertility. So they will just tell you, okay, go away, take your folic acid and come back to me if nothing has happened in a few months. Whereas we know that there's so much more that you can do in terms of fertility. Like, in terms of sperm health, in terms of egg health, like you have a 2 to 3 month window in terms of sperm health and a 3 month window for egg health. I suppose this window of opportunity where you can really optimize the health of the egg and the sperm, and it can therefore go on to, I suppose, copy the correct number of chromosomes and result in a healthy pregnancy. But this is, again, there's just this misconception as to what you like can and can't do to really optimize your fertility. There's so much that you can do.
I suppose that's the thing in healthcare in general. It's finding the right healthcare professional to talk to. So the GP is expected to be, have someone coming in with constipation, there's someone coming in with infertility, there's someone coming in with a chest infection, there's someone coming in with ingrown toenail. Like to expect them to be an expert in all of those things is impossible.
Yeah, it's unfair. Yeah, absolutely.
I suppose my thing is with you. So do you find people come to you after they maybe have got disillusioned with the advice that they've received elsewhere?
I think it's that they just kind of feel totally in the dark and totally lost. So a lot of people coming to us have gone through the GP stage and are kind of facing this gauntlet of IVF or like IUI or like fertility assistant treatments. And very often they don't need to go down that route, and we can like manage things naturally. And it's like even like just reading their consultation form really quickly, I can just see clear as day, like this is what's going wrong.
And what sort of examples would there be that you would spot that maybe?
Like very often it's when it comes to female fertility, it's like or issues there, it's that they don't have a regular menstrual cycle. So the reasons for that might be hypothalamic amenorrhea, it might be PCOS, it might be that they have like a really short like luteal phase. So like you have your menstrual cycle, if it's typically 28 days, you have your follicular phase at the first half, which is 14 days long, and your luteal phase, which is another 14 days after ovulation. And a lot of women, especially lately, that I'm seeing have like what's called a luteal phase defect, where their luteal phase isn't as long as it's supposed to be. And we know that in the like after ovulation, in that kind of second half of the cycle, we know that progesterone needs to be maintained at a high level in order for, like, because progesterone is what essentially keeps us pregnant in those first couple of days and first couple of weeks. So if you have a woman who's coming to us and they have like a really short luteal phase, if you imagine they could easily be having a fertilized egg, but because your progesterone drops too quickly and the luteal phase isn't long enough, the embryo doesn't have that chance to really like embed into the uterus and like have that progesterone peak high enough to actually maintain the pregnancy. And inevitably what happens is if your luteal phase is too short, your progesterone drops off and you shed the lining, and that's a huge factor for fertility. So like say for example, I had a client working with us, started with us last week, and her cycle, she knew that she was ovulating on day 18 and her cycle was lasting 24 days. So her luteal phase was lasting 6 days instead of 14 days. And she's been trying for a very long time. I think it was 11 to even like 12 months. And she's been back and forth to her GP, and her GP hasn't twigged. I don't know if it's like they haven't twigged or they haven't asked her how long her cycle is, but it's very much that I don't know, it's just so frustrating that they don't refer on. So like in the same way, if someone came to me who had a broken leg, there's a couple of things that we can do with nutrition, like in order for them to recover optimally. But I'm not a physiotherapist. Like I'm going to send them on to a physiotherapist. It's just, I think that's one of the reasons that we've really gotten into this space, because it's so frustrating, to be honest. It's really, and like sometimes upsetting. Like there's some calls that I come off and I'm just like, I'm really going to get upset now talking about it, but I'm like, how has someone gone this far and no one has said it to them?
I know. And even what you're talking about there, even just to go back a little bit, you speak about it so comfortably, but I know that I would say 99.9% of the females in my life wouldn't know what luteal phase meant. So even, do you mind going over that again? So it's from the day you ovulate until the start of your next period is your luteal phase, and that should be an optimal length of time. So not too short, and too short is very often the reason maybe people aren't getting pregnant.
Yeah, exactly.
Okay.
Yeah. So your luteal phase is like your progesterone dominant phase, whereas your follicular phase before ovulation is your estrogen dominant phase. So it's funny, like I always say to people that like there's a reason that you feel very different on day 14 of your cycle than you do on like day 26. So it's like day 14, like in a typical 28-day cycle, we've ovulated, estrogen is like at its absolute highest. Like these are the days that like you have that real spring in your step. If you're way more creative, you're better at public speaking. Like, do you ever notice there's days where you're just like fumbling on your words and you're just like, oh my God, what is wrong with me? You feel better. Like your skin is more glowy. Like your body is literally trying to make you go out and like be more confident and like have sex basically to get pregnant. Whereas then in our luteal phase, like when our progesterone peaks, like our progesterone kind of has like a really calming, like kind of sedating, like anti-anxiety effect on us. So your more progesterone like dominant phase will be when you become like more insular, when you're like, oh, I don't really fancy going out tonight. I kind of just want to chill on the couch. You're a little bit more lethargic. So I always say to people, it's like tracking your cycle is one of the most empowering things that you can do as a female, because you start to learn like, why do I feel like this on day 6 and I'm literally fit to absolutely bloody murder my other half, or murder someone on like day 26 to day 27, or you're really low, or you feel really, really down. So I think it's so important to like get more in tune with our cycle and understand like the fluctuations in hormones, like the effect that they're going to have on our mood and the effect that they're going to have on different, like just essentially our personality, really.
Something else you mentioned, again, it just rolled off your tongue, hypothalamic amenorrhea.
Yeah.
Again, I would say a lot of people aren't familiar with that term. Do you want to explain what that is?
Yeah, so hypothalamic amenorrhea is essentially, we'll call it HA from now on.
Yeah, HA.
I call it HA. So it is essentially the absence of your period for longer than 3 months. And very often it is an issue to do with insufficient calories, potentially overtraining, or a combination of both. So we see this very, very often with clients coming to us. And one thing I would always say is that like it's just human nature. People kind of tend to look for like the easy way out. So like I will get so many messages being like, what supplements do I take for hypothalamic amenorrhea? And there are so many supplements, yes, that can be really, really effective, and supplements that can kind of like help like kickstart your cycle. But 99.9% of the time, like a lot of women need to eat more, exercise less, and manage their stressors. So that's one big thing.
And people associate a loss of cycle with body fat percentage. And that's not actually the criteria. It's actually to do with the balance of calories in and calories out.
Exactly.
And I had this experience whenever I played basketball. Towards the end of the season, I would lose my cycle. And as soon as I stopped playing, like the season ended in April, and then I would get my cycle the following month. But it absolutely was not to do with, low body fat. I probably had more body fat back then than I have now. But I remember it was that I was burning more for those last few weeks of the season. I was burning more than I was taking in. And that's when I would notice that my cycle. So I've known personally that it's not a body fat thing, it's a calorie balance thing.
Yeah, so you could have someone who actually has like a very normal or even like slightly higher body fat. But if they're body is essentially under stress. Like, so I always say to people, like, we typically associate stress with like financial stress and relationship stress, but very often like our body sees a calorie deficit and overtraining and fasting in the morning and having coffee first thing in the morning and not having breakfast. They're all stressors on our body, and that's what's going to kind of kick out sometimes our female hormones and prevent us from having a period or from ovulating.
And I'd say at times that's hard to, if you're dealing with someone maybe who's conscious of body composition, or they're trying to maybe be a certain size, or they want to drop a certain size maybe for whatever reason. So is that hard to get that message across to females that, if they want to fix their cycle, they need to maybe ease up on the training? Like a 25-year-old, and I know people who have had Pcos, like say they're 25, 26, 27, they've gone to their GP and they've said, and they've said, are you trying to have a baby? And they're like, no. And they're like, okay, don't worry about it. You know what I mean? So I just think if you're in your 20s and you're nowhere near, and I think because of our background, we probably have a sense of how important looking after our body is now for down the line. Whereas I think a lot of people live in the moment. So for a girl or a female who's trying to maybe fit into a wedding dress or trying to drop half a stone, their priorities are probably not their cycle.
I know. And it really needs to be a priority shift. And it's not, like I would say, like having a regular cycle or ovulating isn't just for getting pregnant. Like ovulating and having a cycle is so important for our bone health. It's so important for our sex drive. It's like we're supposed to have these hormonal fluctuations. Like I always think that if you don't have a cycle, if you don't have those hormonal fluctuations, you're kind of just flatlining, like for the however long it is that you don't have that cycle for. So you don't have those peaks and troughs in estrogen and progesterone, and it's not truly the way you're supposed to feel in a given month. So absolutely, like it's really a case that having a cycle is not just for having a baby, and that's kind of the really frustrating thing, aside from where we're coming from. Because what will happen is we'll have clients coming to us who have PCOS, and they've just been, say for example, PCOS or HA, and they've just been put on the pill to...
Sorry, do you want to explain PCOS?
So Pcos, yeah.
So people aren't familiar with what that is.
Polycystic Ovarian syndrome. So we can go into that a little bit. more in a second. But we'll have clients who are coming to us with HA or PCOS, which is another kind of going off on a tangent again, but these are so often mixed up and misdiagnosed. So you'll mix up one for the other because the symptoms are quite similar. So yeah, we'll have women coming to us who have just been prescribed the pill to quote unquote regulate their cycle, but you're not regulating a cycle with pill. You're just kind of getting a false period essentially,
and disguising any issues.
Exactly.
Probably.
So our issue, like the issue that we have with this, is that we have clients come to us who were diagnosed with PCOS, say in their early 20s, were put on the pill for 10 years, and then they're like, right, I want to have a baby. And when they come off the pill, they've just like all they've done is kick the can down the road for 10 years to deal with at a later date when they want to have baby. So I suppose, and when that happens, and when we obviously they come off the pill and we try and regulate things, it can take a little bit longer to really like unravel what's been done over the last couple of years. So it would just be so much easier if they dealt with it with nutrition and lifestyle changes at that time and didn't have to. And this is the other thing as well, they have a huge amount of anxiety. Like there's nothing as awful as coming off the pill when you're 30 or whatever age you want to have a child and you don't get a regular period, and the more the months go by, it's just so stress inducing, and then that's going to have a negative effect. It's like this almost like a self-fulfilling prophecy, and it's just this kind of like vicious cycle. I suppose it's just really important that it's dealt with properly at that time.
What you just mentioned about how important it is for females to have their cycle and to experience the peaks and troughs and hormonally, the fact that that's not the way the menstrual cycle is taught in school. It's taught as literally this physical thing that happens, and it's also always treated as a nuisance or like a negative association. You know, you're going to feel bad, you're going to suffer PMS, you know, it's a nuisance if you play a sport. It's all of those things, when people avoid all of these activities because they've got their period or they pull out of things. But there's definitely, like, there's just such a gap in information for females.
And then a big part of it is obviously both of us coming from a research background. We both know, especially in sports performance, we don't include women in trials. Like, I know. 9 times out of 10, you know?
Because, there seemed to be a nuisance. I don't think there was anyone else that involved females in their research because of the complexity of it, and you can only get them into certain times.
And then like if you look at any of the research on fasting, like obviously intermittent fasting and time restricted eating has become huge lately. But like most of that research, if not all of that research, has been done in males and the benefits in males. And then we try and take that research and apply it to females, and we're wondering why females are really stressed and not getting a cycle, not getting a period, because they're fasting. So it's really, really interesting.
And with the fasting, again, you're talking about putting themselves into a caloric deficit, so they're not taking enough calories, so they're not getting their cycle.
Yeah, but it's not just, I suppose when you're fasting, you're, as you said, you're more likely to eat less calories in a given day. That in itself would be a stressor. But the other thing is when you wake up first thing in the morning, your cortisol hormone, your stress hormone is at its highest. That's what wakes us up in the morning. And what we should really aim to do is have like some sort of something to eat, to, especially when we're females. Males can 100% get away with it. But we should ideally like bring our cortisol levels down, especially if you're someone who your cycles are irregular, or maybe you're having an ovulatory cycle, so you're getting a period but you're not ovulating. So if you are that type of person who maybe just I always call it like your stress bucket is too full, you have too many stressors all at once, then if you're waking up in the morning, your cortisol is at its highest and you're not having anything to eat, that actually increases the circulation of our cortisol and our adrenaline or our catecholamines as well. So it's just a huge stress response to be placing on your body if you're the type of person who just has too much going on already. Yeah.
And when you say, so food is important to have first, any particular food, or is it?
I would always just say like a balanced meal.
Okay.
So like carbohydrates would as well bring like down your stress hormones. So like kind of a good source of carbohydrates, whether that's like your eggs and your toast, or like or oats or something like that, like in combination with like a fat and a carb source, or fat, carb and protein source.
Just being conscious.
Yeah, exactly. But again, like I have clients who can get away with murder when it comes to fasting and be in a calorie deficit and get a perfect cycle and have 0 PMS. And then we have clients who can't do any of that stuff. So it just completely depends on the person.
Circle of Light brings you a range of wholesome, all-natural health drinks to guide you on your journey to long-term well-being. Our unroasted green coffee, Fibre 89 and Triple Z will help you choose health the natural way.
Something that I mentioned earlier on, we were talking about how just the negative associations around, for females from they're really young, and hearing probably people crib and cry about their period and how it impacts them, and PMS. So is PMS just something that people have to accept? Is it, again, does that depend on the level of your stress bucket or?
Yeah, so this is another kind of misconception about periods and the kind of the couple of days before you get your period. So like PMS, premenstrual stress essentially is what the definition is for that. Basically, yes, it's normal to get a little bit of PMS, but if you are like experiencing like debilitating symptoms like really bad period pains or really bad migraines or just really like out of sorts, really, really low, like that is a sign that there's something going wrong. And like I always say to people that your menstrual cycle or the period that you get or the PMS that you get or do or don't get is kind of like a summary of how you've done for the month. So you'll notice, and I always say this to people, and it's only when they actually get like tuned into it and start tracking their cycle that they realize if you've had a really, really stressful month, very often you'll find like, oh my God, like I'm dead, like this cycle, like I'm really, really tired, my boobs are really sore, I've really bad period pains. Like there's a reason for that. So like there's this theory, it's not hugely supported by research, but there's this theory that it's what's called like pregnenolone steal. So if you imagine we have this mother hormone called pregnenolone, and that essentially makes cortisol and it makes progesterone. So cortisol again is our stress hormone, and progesterone is it has kind of a protective effect against PMS. So like I always say, like progesterone is like your fight against PMS, so like your defender against PMS. So again, as I was saying, like your progesterone, it has an anti-anxiety effect, it has a very calming effect, so it kind of protects us against like the drop in hormones just prior to our cycle. What's interesting about this kind of whole theory of pregnenolone steal, so if we are too stressed, we're going to be pushing out more cortisol, we're going to be pushing out more adrenaline, and the theory is that we're essentially stealing pregnenolone away from progesterone because we're making more cortisol. So that's the idea behind stress having a huge impact on your PMS, and I've seen it firsthand. Like it's insane. Like if I could just do one thing for all of our clients, it would just be take away their stress. Like if I only had one choice,
and that's physical stress as well as external lifestyle factors.
Exactly. It's stressors in general. And yeah, like again, as you said, it's really bringing it back to, it's not just psychological stress. It's overtraining, it's undereating, it's undereating, drinking too much coffee, those kind of things. So
you were saying that there's a misconception that PMS is something that every female has to endure and put up with.
So if the symptoms are debilitating, there's something going on there. There's some sort of an imbalance. There's something that you can be doing to really like optimize your health that will help with your PMS. So it's really like as I was saying, it's a summary as to how your health is really. Should
you require painkillers? Like, is that a sign it's too much?
That's a sign that 100%. It's not normal to have painkiller. If you think like from an evolutionary perspective, why there's a reason for everything that happens in our body. But what would be the reason for us to be in so much pain to take painkillers? No, it's definitely a sign that things are amiss, but also I would be mindful of endometriosis, which is something that we tend to work with as well. So we know that with endometriosis, I think the average amount of time that it takes to be diagnosed is 10 years, which is absolutely terrifying.
That's horrendous,
it's horrific. It's absolutely horrific. So it's so important that it's just so important I suppose it's so important for us to get more in tune with our cycle so that we can determine like, is this an issue or is this normal? And I'm just maybe not looking after myself as well as I should be.
Michelle, you were mentioning Pcos, Polycystic Ovarian Syndrome, and you said that is one of the most common reasons that you might see that people don't have a regular cycle. How does Pcos manifest, or how would people know if they have Pcos?
So PCOS is a disorder in which we have excess androgens, so excess male hormones as females. So how people would know that they have PCOS, they essentially have to meet 3 criteria. So it would be irregular cycles or like missed periods. That would be a big one. That's very often why it's confused with hypothalamic amenorrhea. And what's really scary about the confusion and the misdiagnosis between HA and PCOS is their treatments are completely different. So you could exacerbate someone's PCOS or exacerbate someone's HA if they're not being given the right advice. Back to PCOS, the other diagnostic criteria would be like physical signs of excess androgen. So that might be like kind of cystic acne around the jawline and like facial hair. Like I'm not talking about like kind of peach fuzz that we all kind of have, but more like black, like thick hair. The other thing would be cyst on the ovaries. But one thing I want to make really, really clear is that you don't need to have cysts on your ovaries to diagnose PCOS. And also, on the flip side, having cysts on your ovaries doesn't mean that you have PCOS. And this is where it's very often misdiagnosed. So a doctor might send you for an ultrasound, see that you have cysts, see that you have irregular periods, and be like, right, you have PCOS. But they need to have the physical signs on top of that. So they would also, those people might be kind of put into the category of HA. But as I said, the treatments are so different. So it's really important that you're not misdiagnosed with PCOS and HA.
And it might be too complex to go into it at the moment, but can you give an example of how the treatments differ?
With, say, for example, with HA, like as we were chatting about, very, very often, I suppose not even very often, HA is related to stressors. So our plan is to really like minimize stressors as best we can. And one of those stressors very often is that people are over exercising, and we just need to really reduce their exercise and increase potentially their calories, increase their carbohydrates. And then on the flip side, PCOS is a little bit different in that it's really similar to how you would manage someone who's type 2 diabetic. What's the best thing you can do for them is to get them exercising, especially resistance exercise. So resistance training, which is going to enhance our insulin sensitivity, which is very often the issue with PCOS, is incredibly effective for managing PCOS. So if you were to tell someone who actually has HA that they've to exercise more,
yes,
it's going to make their HA worse. So yeah, that's one of the kind of the differences. The other difference would be sometimes and quite often someone that has PCOS can benefit from like managing their carbohydrate. And I would never in a million years put like anyone who has PCOS on a low carbohydrate diet, but very much like a moderate low GI with like complex carbs and lots of fruits and veg in there. So they can really, really benefit from like quite similar to how you would manage, again, like someone who has like insulin resistance or like is borderline pre-diabetic. On the flip side, if you were to tell someone who has HA that they need to cut down their carbs, that could be probably the best thing for them is to increase their carbs and to really get things kick-started and to really bring down those stress hormones. It's always really difficult to decipher like what it is that's making the real impact and the real difference. Like I always say that it's very much a cumulative of effect. So we don't know. We would never give one single piece of advice for managing PCOS or HA. It's always very much like a holistic perspective. I kind of hate using the phrase holistic perspective, but it is.
Describes it best. Yeah.
So it's difficult to say like this is exactly what has helped or like enabled you to recover or enabled you to get your cycle back, because it is very much a combined approach of nutrition, supplementation and lifestyle changes.
So you mentioned a number of reasons why, females might be struggling to get pregnant. So HA, PCOS and the shortened luteal phase. Is there anything else that you see?
One big one that gets missed very, very often is low thyroid function or a subclinical hypothyroidism. So
when you say subclinical, just explain what you mean there.
Subclinical means that it doesn't fall into the category of being diagnosed as overt hypothyroidism. So like it doesn't fall into that range. And this is where the issue lies. So with thyroid function, when you have a low thyroid function, so hypo, I always remember it as hypo, low, like low, rhymes with low, and hyper means like you're high.
Yeah.
So it's the only way I can remember it. So when you have low like hypothyroidism, that will present as elevated TSH, so thyroid stimulating hormone, because your thyroid, like you're pushing out more TSH because you're trying to stimulate your thyroid to get going because it's not functioning optimally. So with clinical, like overt hypothyroidism, you're looking for a value of 4.2 TSH. So anything lower than that is classed as normal. The issue is that what is normal in someone who's not trying to have a baby is not the same as what's normal in someone who's trying to have a baby. And the reason for that is that the baby actually doesn't have their own thyroid gland and therefore can't produce their own thyroid hormone. So the baby will rely really heavily on the mother's thyroid in the first trimester or even the first 20 weeks really. So what the literature now says, like there's loads and loads of literature to show that what's recommended in someone who's trying to conceive is a value of 2.5 or lower. The issue is that people will go to their doctor after trying to conceive for quite some time, or potentially after experiencing like 1 or 2 or maybe more miscarriages. Although when they've experienced 3, they'll normally go and they'll be sent to a specialist. And the issue is that they will have their bloods done and their GP will say, oh, your thyroid is normal. And I always say to clients, ring your GP up and get them to send your results to you. And like Sarah, I can't tell you how many times this has happened. Like it literally breaks my heart. Like we'll have clients come to us and say, I got my TSH value and it's 3.8 or it's 4. And I'm like, the research shows that this is not optimal for having a baby. So if your TSH is really, really struggling and it's up around like 3.5 or 4, it means that your thyroid itself is struggling to produce enough thyroid for the baby. Like it's a case that they have elevated TSH, therefore insufficient thyroid hormone, and that's the reason that they can't get pregnant in the first place, or they're experiencing chemical pregnancies or early miscarriages. And this is the reason that I think that I actually had a miscarriage on. We were chatting about this yesterday. That's the reason that I think that I had a miscarriage on our first pregnancy, because it actually went under the radar, and it was only when I got tested again that my TSH was up around 4, which is why this is again, I suppose, one of the reasons I've become so passionate about.
Yeah, because you've experienced firsthand.
Yeah, absolutely. So it's heartbreaking. It's literally heartbreaking that someone would have to go through 1 or 2 miscarriages to realize that their thyroid has been functioning suboptimally and that they didn't have to go through that in the first place.
And what did you do differently then, in terms of how did you change? With
Thyroid Health, it's very often hereditary. So my mum has hypothyroid, like overt, like clinical hypothyroidism. So hypo. So it would run in the family, which is a big factor. So for me, I actually just went on medication because there is nutrition strategies that you can do to help, but inevitably they're going to take a lot longer than what taking medication is going to do. And for us, we wanted to have a baby straight away as soon as we had a miscarriage. So I just felt like the right thing to do was just to start on Altroxin. But I know for next time that I'll be able to optimize things. And I'm currently managing things like with nutrition, with, I suppose, as much stress as I can reduce, and supplementation. So I won't have to go on medication for the next time, hopefully. Yeah.
And have you been testing it to see that you're managing it? That's amazing.
Yeah.
So you're able to manage it that way. And with Altroxin, the medication for hypothyroidism, during your pregnancy, did you stay on that the whole way through?
Stayed on it the whole way through, yeah. And I was checked really, really regularly, which was great. Then once you have a baby, normally your thyroid actually rebounds. So I just came off it. So I haven't been on it since, and I've been able to manage the TSH or the thyroid kind of values.
And I know, I suppose, with miscarriages, that's what you believe happened in your situation. Was that confirmed by a consultant, or was that just your own research?
That's kind of from my own reading, that's kind of what I determined. But at the same time, nobody knows.
No,
there's no way of knowing
unless
you were to go and kind of assess things. Like normally if someone's had a miscarriage 3 times in a row, they'll go and kind of assess the embryo for any kind of chromosomal abnormalities. But unless you do something like that, there's no way of knowing what the issue was. But you just kind of have like a feeling in your gut that that's what it was.
And sometimes you want something to...
I know, exactly. Something to kind of hold on to so that you can feel like, okay, you can make these changes.
That.
Yeah,
totally.
Yeah, we're all total control freaks.
Totally. Yeah, no, completely.
But this is the other thing, like we're working with fertility clients when they're kind of in the darkness about these things. It's so lovely to be able to say, okay, you can do this, this and this. And it's almost like they take ownership of it again instead of leaving things up to chance. So it's just so lovely to be able to give them those tools.
Yeah, because there is an element of, with trying to conceive, it's kind of, especially if you're not up to speed and you don't have a good, I suppose, awareness of your body and your cycle. And as you said, there's so many women aren't even familiar with of when they're ovulating. And even at that, it's very hard to pinpoint it unless, you have all of the signs, but you really need to be tuned in and up to speed with that.
Yeah, absolutely. You really do.
And can I ask you, is it your experience then with miscarriage and trying to get pregnant? Is that what brought you into this area that has given you that? Or were you passionate before that?
I was definitely passionate about it beforehand. And I feel like we do so much planning when it comes to buying a house and prepping yourself for getting married and like making sure your skin is glowing and making sure you feel great. And when it came to I was thinking about trying for a baby, I just felt like there was just nothing, just like take folic acid and hope for the best. And it was only when I started to do a little bit of digging that I was like, oh, there's actually so much that you can change. Even like stuff that we were chatting about recently, like the kind of smart swaps that you can do. Like it's not just nutrition, it's not just supplementation and like managing your stress, but like the swaps that you can do in terms of like the day-to-day items that you're using, like your plastic bottles and your soaps and your detergents and those kind of things. Like there is so much that you can do to potentially improve your egg health and improve sperm health.
In terms of smart swaps, what do you mean there? So
I would always tell clients to be really conscious of like what they're putting on their skin and what their makeup that they're using and the bottles that they're drinking out of, because we're being exposed, and I'm always kind of mindful to not be like really overzealous about this. Yeah, because it's inevitable. We're exposed to this kind of stuff every single day of the week, but we're exposed to so many different ingredients that are potentially having a negative effect on our health. And there is some research to disprove that some ingredients like that they're actually quite safe to use and there's a safe limit, and that our kidneys and our liver do a really good job of kind of ridding these chemicals from our body. But the issue is that there's been no research to show like the cumulative load and the effect that everything all at once is having on our system. So like the plastic bottles that you're drinking out of, the plastic tubs that you're like kind of is packaging your food, the cosmetics that you're putting on, like the makeup that you're putting on, the soap that you're washing your hands with, your detergent, like the car fumes that you're fake tan, the car fumes that you're breathing in. So there's been no research to show like is the cumulative load that we're accumulating over the course of these years, is that having an effect on our health? So I would always say like what we don't know, if that makes sense. We don't know what effect these are having. So it makes sense. Like I think it's wise to make swaps where we can. And like I would never say to someone that they can only like they have to live in a glass bubble and can't breathe in whatever. But I think it's really it just makes sense to make smart swaps where you can. So like smart swaps would be, say for example, instead of drinking out of like a plastic reusable bottle, stainless steel bottle is so much better. Glass, or your stainless steel coffee cup, because again, if you imagine if you're boiling like hot coffee into like a plastic reusable cup, the hot water is leaching, is kind of encouraging the chemicals to leach into the water. The soaps that you're using, maybe like switch them for parabens. So there's another thing like as well. So one thing that we do absolutely know is just to kind of give you a bit of a background, like all these chemicals are what we call endocrine disruptors. So endocrine means hormone. So they're potentially having this disruptive effect on our hormones. And one that we know really well is phthalates. And that's derived, I think, from a plastic. And that was kind of routinely in soaps and cosmetics up until recently. But I think it was the European Food Safety Authority determined it as a reproductive toxin.
And that's reproductive from a male and female
exactly,
sense. So sperm and egg.
So they were finding that it was having effects on estrogen, on progesterone, on testosterone in men and women. So they actually banned using phthalates in any cosmetic products in Europe. So at least we know that there is there's none of those kind of
but in the US, are they FDA approved?
Yeah, no, they're FDA approved. Yeah, they're fine.
They're
as far as I know, they're allowed in America. Yeah. Because I remember it was basically because when I was pregnant, I was reading a really, really good book called It Starts With the Egg. And it was basically just about explaining what you can really do to like optimize your fertility and optimize the health of your pregnancy. And one of the things was like, if you do one thing, make sure that you don't use nail varnish. And I was like, oh my God, I can't use nail varnish because there's phthalates in it. And the idea is that your nail bed is like really highly absorbative. Is that even a word?
No, if you ever see them under, they're porous.
Porous, yeah. So I was going like around the bend trying to find a nail varnish that didn't have phthalates in it. And I think I put something on Instagram and someone messaged me and she was like, I own a nail salon. She was like, phthalates are actually banned in nail varnish in Europe, so you're fine. I was like, oh my God, thank God. I can paint my nails while I'm pregnant. So
I'm sorry, I'm going to jump a little bit off track there, but something you said there, and I hope you don't mind me asking you this. After your miscarriage, did you, I'm going to use the word obsessive, that's probably too.
Oh my God, 100%.
Did you, so did you become?
Yeah, 100%. Yeah. Like it was like, it's just, I think do you know what it is? I feel like when I want to do well in something, I just put the work. I work really hard, and
you get the outcome when you plan and you prepare.
Whereas fertility, you can't do that. You can put in as much work as you want, and sometimes it just doesn't work out. It just doesn't go that way. So for me, yes, like I completely obsessed over this kind of stuff. I would go as far as saying that being pregnant after a loss is so much harder than the actual loss itself for me, because the loss itself was something that I could process, and I was like, I can just move on from this. It's fine. Like, I'm going to be okay. I'm going to do everything that I can. Whereas when I felt pregnant, thankfully we got pregnant straight away afterwards. But when I felt pregnant, I was just so out of control. I was like, there's nothing that I can do. Like, I just felt like I can only do so much, and it's just completely left up to chance. And I just felt like it was
40 weeks then.
Yeah. Well, thankfully for me, I think the anxiety really subsided after about 16 weeks. We got like another, I think at that stage we were on our bloody like 6th scan. But yeah, like it was really, really hard. Yeah, really
I'd say that's part and parcel though. I mean, it's to be expected.
Yeah.
And you absolutely nailed it there. It's something that just feels totally out of control and up to chance.
And you know, it's really hard as well. Like, you know that the stress negatively affects your pregnancy. So you're like, don't be stressed. Trying to tell someone not to be stressed is trying to say, don't think about a yellow bus.
Yeah. Oh, totally.
Like,
yeah.
It's impossible, you know? So I would like to say that I managed my mental health in the first like 16 weeks, but I was an absolute basket case, like borderline, like probably should have been committed. Yeah, it was really bad. Yeah.
And were you aware, can you look back and see that? Or did you know at the time?
I knew at the time.
I'm out of control.
Yeah. Yeah, I knew at the time, like even stupid stuff, like I can't believe I'm telling you this, but like I would be coming up to traffic lights and I'd be like, if this light turns red, I'm going to lose this baby. Yeah. Like mad stuff.
Yeah.
Absolutely insane.
And you said something to me, so we had a phone call yesterday, and I'm going to nail you on this now.
Oh God.
And actually we shouldn't be laughing but it has made me think, and I've thought about it since you said it to me. So we obviously followed each other on Instagram.
Yeah.
We always have. And you told me yesterday, you mentioned someone who's well known that had a baby the same time as that I had my last baby. Before that, you just had said that how difficult it was.
Yeah.
And I just sort of said, Michelle, that's me. That's Sally, my baby. That would have been the exact
born
same
in
month.
November 2020.
Basically you told me what you did.
Yeah, I told Sarah that I was like, I'm so embarrassed to say this to you, but I actually unfollowed you when I found out that you were pregnant. And I just did like a mass unfollowing, and I just culled so many people from Instagram, from my timeline, because I just wasn't in the right mental space to deal with it.
No, but I'm so glad you said it, because it just made me think.
I think things like this need to be normalised.
Totally.
100%.
Yeah. But you saying that to me, normal. Like I wasn't offended. If anything, I thought, God, yeah, you really have to think about those things. Now, I'm not saying that because everything you could post on your social media could trigger something
in anyone.
Do you know what I mean?
Absolutely.
Of course. Yeah. But still, it made me think. Yeah, and I'm glad you told me.
These things need to be normalised. And you were saying to me as well, like, you seem like the person that would be so together. Yeah. And I said to you, like, I had the most incredible support system and
knowledge base. Like, so after someone has a miscarriage, and even the fact that you probably identified the reasons, you knew the steps that you could take to increase the chances of conceiving again. But even with all that information,
so much mentally during that stage. Yeah.
It just shows your mental health is very fragile at times. Yeah.
100%. Yeah.
So Michelle, we're going to leave it there, that there is so much information in that. And yeah, it has really made me think about how much information, again, females in particular, that we don't know about our own bodies, about our own health. And school is really where this stuff should be addressed.
100%.
So Michelle, anyone who's looking to, I've mentioned your Instagram page, which I said this to you, I've said this to you a few times, you're one of the pages that I would recommend all of my friends to follow, and anyone I know, because I know that all of the information you put up is evidence-based, scientifically backed. It's a brilliant place for information. And we've talked a lot about female health, but it's not just, it's a page about nutrition and general health. So men and women alike, it's somewhere that definitely I would send them. And it's the Fit Clinic, isn't it? Just
on Instagram, yeah.
On Instagram. It. And then your website is thefitclinic.ie.
Yeah, that's it.
Thank you so much for your time, for all the information. It was a pleasure talking to you.
Thank you.
And yeah, thank you.
Thanks so much for having me on. It was great.
If you have been affected by any of the topics raised in today's show, we have a number of resources linked at circleoflight.ie. Thanks for tuning in to the Natural Health Revolution. We hope you have come away more informed and empowered to make little adjustments towards a happier, healthier way of life. We are dedicated to spreading the message of natural health, and we hope that if you enjoyed this episode, you will join us again for more experts and insights from the fields of health, nutrition, and well-being. We would love to hear from you. So if you have any questions or want to know more about us, you can find us online at circleoflight.ie and on all social media platforms.